So I was on a call earlier with a group of advocates in southern states, and they let me be an honorary southerner for this phone call that we have once a month. But anyway, they said, like, can you, in the introductions, everyone just talk about a bright spot in your week? And most everyone's bright spot had to do with weather because, those bright spots are few and far between when it comes to some of the other aspects of our lives.
They were weather related?
Yeah, I mean, mine was that the snow's melting. We have had snow on the ground in Topeka, Kansas since the 5th of January.
That's a long time.
It's unheard of. I don't really ever remember that happening before for so long.
And now we have mud.
And now we have it. Well, I
My
mean, that
dogs
is
are
the
covered
thing.
in it. It's a nightmare.
I got home yesterday and there were paw prints on my bedroom rug, my bedroom floor. There were conversations.
Yeah, that is the thing. When the snow melts, the mud comes. But
Well, welcome back to Health in the 34th podcast. I am Marissa Alcantara, the Policy and Advocacy Specialist for the Alliance.
I'm Lacey Kennett. I'm the Director of Communications for the Alliance.
I'm April Holman, the Executive Director of the Alliance.
And we have a special guest here today. Adrienne, would you like to introduce yourself?
Yes, I'm Adrienne Olejnik. I'm the Vice President at Kansas Action for Children, and I'm glad to be here with you today.
We are so glad to have you. I think you are, well, we had Sean. I guess he's kind of a special guest, but you are our first, external special guest of the season. We're so glad to have you.
I am happy to be here, and thank you for giving me the honor.
Do you want to tell our audience a little about yourself and KAC and what you all do?
I've been at KAC for about 6 years, and prior to that, I served on the board of Kansas Action for Children a long time ago, so it really lit a passion for public policy for me, and so I'm so glad to be there now and giving back because I think it really changed my life in my mid-20s when I didn't know as much as I should have about how state government worked and the role of policymakers and how just regular people could make a difference. Kansas Action for Children has been around for almost 50 years now.
Wow.
We're just a few years short of that. So a big celebration will be coming here in a few years, I'm sure. But we really have stayed the course in the same mission, I think, during that time. And it's essentially to be an independent voice for kids and families in our state. So we look at research, we look at data, and we try to understand what are the best policy choices and what is the funding needed so that they have the best outcomes.
When we were planning and thinking about upcoming episodes, we saw that KAC, who partners with the Georgetown University Center for Children and Families, just released a report on Medicaid and how it impacts rural communities. And you partner with them and are a big part of that. And so we wanted to have you on so you could let us know about it and our audience. So do you want to tell us about this report?
I'd be happy to. So we are part of what is called the Finish Line Network. Oh. It's not every state in the U.S., but probably about 2/3 of states are part of this network. And we receive support to work with the Georgetown Center for Children and Families, and they have been an invaluable resource to us to not only understand the inner workings of Medicaid and the Children's Health Insurance Program, or CHIP, but they provide that technical assistance to advocates like us in the states who are walking into the State House on a regular basis and talking to lawmakers and advocating for kids and families so that Medicaid and CHIP serve them the best that they can. So when Georgetown releases key reports like this one that they did earlier this month, we're asked to help promote that report. And of course, we're happy to do that because there's always something to be learned and to be shared about the state of Medicaid, especially as it relates to children and families. So the report earlier this month really highlights and takes a deep dive into the impact of Medicaid across the U.S. in small and rural areas. Mm-hmm. And they did, again, in-depth research on every state. And so I have some Kansas-specific data here I can share in a bit. But with federal cuts looming for Medicaid at the federal level, it was timely, and I don't think that it was necessarily planned that way. But shortly on the heels, of some other discussion about Medicaid funding, again, we can get into that a little bit later. This really put a spotlight on how important Medicaid is, not only to our entire state, but specifically in our rural areas.
Mm-hmm. when I was reading the report, what really struck me was Kansas is obviously very rural compared to many other states in the United States, but really across the board from birth until you're a senior, all ages of Kansans in rural areas rely more on Medicaid than the residents that live in more urban or suburban areas.
That's correct. And we know that Medicaid is such an important program, essentially from birth to end of life. Not only do pregnant women rely on Medicaid, as over half of the births across the U.S. are from women who are enrolled in Medicaid at that time. That holds fairly true in Kansas as well. But we know that Medicaid provides key coverage for nursing care services. Without Medicaid, we would have disintegrating health systems across our state, and that is especially true in rural Kansas. So what we're seeing is the impact of Medicaid, especially in this report, as it highlights that children and adults and the elderly in Kansas, especially since we haven't expanded Medicaid, those are the populations that are going to be hurt the most should we experience Medicaid funding cuts at the federal or the state level. I'll give you Kansas, for example. 32% of children in Kansas in small towns and rural areas rely on Medicaid as their source of health coverage.
Wow, so like 1 in 3?
1 in 3. And that's compared to a little bit of a lower percentage, 29% of children in metro areas.
Okay.
If you start to think about maternal health care, we know that labor and delivery services are on a decline in availability across our state. It is a very challenging area to keep those services available when they're expensive and maybe aren't used on a regular basis. So this report also highlighted the impact of Medicaid funding in small and rural areas on the availability of those services as well. So there's declining incentive for health systems to offer the services that kids and families need to be able to live in these areas of our state.
I think, that really confirms some of the things, or it goes with a lot of the things that we know just about the overall healthcare system in rural areas in our state, and how some of that has become precarious over the last decades. We know that there is a higher number of rural hospitals, for example, that are at risk of closure. And I think it goes back to this idea that there has been a migration from more rural areas to urban areas in our state that has been really geared towards opportunity and economic concerns. But if we want to do things that help bring people back to their rural homes or help them feel like they can stay in the first place, there are things like access to maternity care that really make sense for us to invest in as a state and communities, if that's what we want to see happen. And I think when we talk about some of those potential funding cuts and the impact that they would have on this effort that we're making as Kansans to try and enable people to go back to their rural homes and to stay there in the first place, it's really a threat. It's a threat from a lot of different perspectives, but when you look at it from this rural lens, it's really going against everything that we're trying to do.
We even heard this week in the state legislature, again, it's not unfamiliar to hear about the low reimbursement rates in Medicaid and the state's responsibility to try to keep those current as much as possible so that those who are even able to access Medicaid in our state can find providers who will take Medicaid and they'll be able to access services. So this week, we heard needed support for dental reimbursement rates and also pediatric reimbursement rates. There are pediatricians across our state who can no longer take children who are using Medicaid as their health care insurance because it doesn't pay enough for them to justify turning away other patients. Whether the legislature will add that money, I am not sure. But I think it shows the declining availability, not only in metro areas across the state, but it's going to be even more acute in these small and rural areas across our state where basic care that we all rely on is just not going to be available.
And, it makes sense to me to think that this would be, a problem from a health perspective. But I'm just curious if you have any more insight into what happens. Let's say that a child does have access to coverage through Medicaid, but there's not a network to provide that care for them. So that probably puts them in a situation, or their families in a situation, of trying to piece together the things that they might need health-wise. So maybe they're getting some vaccines at the county health department, and if they have a respiratory issue, they're going to an urgent care facility or possibly to the emergency room. But what does that mean overall for the health of the child if they don't have that regular care from someone who has gotten to know them and their particular issues?
Just think of how busy we all are. It is so easy to just say, I'm just going to wait on that, whether it's trying to make a phone call to a service provider and you get put on hold, and after a while, you're like, it's not worth it. I'm going to hang up. So I think of that example as how often are those parents making a difficult decision of either waiting on care for those kids to see if it turns into something more serious? Are they able to get time off work? Are they able to have available transportation to wherever that service might be available? How do they even know where the service is available? Just think about someone sitting on the phone and calling all of these places over and over to find, can you get my kid seen for this? I think parents out there want to do their best, and I believe that they will prioritize their children's health, sometimes at the sacrifice of their own, as you all have highlighted many times, with not expanding Medicaid. But I think what it means is that we're going to miss out on some preventable issues for kids. And one of the unique features of Medicaid is what's called EPSDT. And it is a required aspect for a child to have early and periodic screening, diagnosis, and treatment. So if something is found early on for a child, they have the right, by having Medicaid, to have that taken care of or improved or seen over time, no matter how much that kind of takes. But what if those services aren't available? How frustrating would it be to say, I have this plan, I have this right, I have this card that says I have access to these, but no one will take it, or they're an hour away. So it's not just the kids who don't have Medicaid or the funding cuts, it's those who even do have Medicaid who are still not getting the services that they really deserve.
Yeah, it sounds like these investments are not just an investment in today and the needs that children and families have today. It is that, but it's also an investment in the next generation. And, the young children today who are going to be adults when I'm a senior, and I certainly want them to be capable doctors and to have, children who turn into healthy adults and maybe don't have as many of the health concerns that they would have if they had a lot of trauma and not a lot of access to the care that they needed when they were children. I think it just really seems like if you're going to make an investment, this one has a really big payoff.
It does. And many right now in our state are looking at our health ranking and how it has declined over the years. And I think that this is a component of the reason of that.
By being able to provide that higher level of reimbursement, that makes it something that pediatricians can really, it makes it viable for them to see all of the children on Medicaid that they can, instead of having to, cap the number that they can do at any given time. It really seems like a win, not just for those children, but for the whole community.
I agree. And I think on this report in particular, not to plug another podcast when you're recording a podcast, but I listened actually last night in preparation for this. The Kansas Reflector had podcast, I believe, last week with Joan Alker. She is the director of the Georgetown Center for Children and Families. And she had a discussion with Clay Wierstein from the Kansas Reflector, and I believe it's Dr. Benjamin Anderson from the Hutchinson Hospital. And it was a really compelling conversation between the three of them about the impacts of Medicaid as this report outlined and how it's affecting what they see in Hutchinson in particular. So it really brought a Kansas lens to this report that I encourage others to go listen to if they want to hear a little bit more about it.
It's great to have research, but if people don't know about the research, it doesn't really do much good. So I think the more we can all really amplify the message of the Georgetown report, I think the better informed we'll be about the impacts.
And it just goes to show that our state here in Kansas, we are a prime example of what they're trying to show in this report. How much kids, families, senior citizens rely on Medicaid as their primary source of accessing the health systems here.
I feel like you don't hear about it as much in a rural context. I don't know why you don't.
I think the topic of personal health care and personal finances is really taboo in rural areas in Kansas. You kind of keep your business to yourself, and so you don't necessarily hear people talking about need to participate in the Medicaid program or that they're having health issues, because those are kind of things that you keep close to your vest. And so I think it's true that we don't necessarily always hear about these things and it being an issue in rural areas, and yet we know from the report and from the data that it absolutely is, and it's having an impact every day across our state.
This is really topical this week because this week was chaos, the week that we are recording this, because of a directive from the White House. Medicaid portals, not just in Kansas, but all over the country, were temporarily shut down. There was a lot of confusion about what was going to be funded at the federal level, what was not, and just chaos for a solid 48 hours, where, at least in my job, it's communicating with the public. I literally would write something and then be like, well, that just changed. We can't use that now. So in this uncertain time with these potential cuts and things, what effect would that have on Kansas children?
Before the chaos, that I think still continues. We already knew coming into 2025 that they want to significantly cut the federal budget. When I say they, the White House, Congress, and in some of the lists that have been released online, we know that their number one target is Medicaid. They do not want to cut Medicare or Social Security, but the number that has been proposed for Medicaid is $2.3 trillion of potential Medicaid funding cuts at the federal level. So let's segue into what happened earlier this week. With less than 48 hours, about 24 hours notice, there was an OMB memo that was sent out, actually leaked essentially, that showed the federal payment freeze. That was really unclear as to what it was going to affect or not, and it was related to different executive actions and other memos that had been released in the prior week. But essentially, you're right, it caused chaos. It temporarily shut down portals until there was a judicial stay of the action, which is what caused those portals to open back up when OMB actually rescinded their memo, kind of. So that's where we are sitting here about 4 days after that announcement happened, where there is still great uncertainty about who is impacted, who is not. From what we understand, the key portals for different departments like health and education to draw down funding are reopened, but it's uncertain how long that will last. We also know that there was an offer to federal employees to take a buyout essentially and leave their jobs. So not only are we seeing this uncertainty from accessing funds that have already been committed by the federal government to states and to individuals across our country, we're seeing possibly a mass exodus of the federal staff who would be there to respond to such a situation, to be able to get clarity on what's happening. So this is all somewhat outside of, what is Congress going to do about Medicaid funding and what's going to transpire later this year. I think this was a taste of what could happen with Medicaid in particular and lots of other funding sources should it be on the chopping block or not be what we have experienced over the past years.
I go to bed early. I might be old. I don't know. So I didn't find out about it until the next morning when I woke up. And Marissa and I went and talked to a group of students in Kansas City that next morning. And when we were in the car talking about it, we were so confused. And we are probably a little more plugged in than the average person about what's going on, especially with Medicaid. So I can only imagine somebody who depends on Medicaid, if they have a child that needs insulin or whatever kind of medication, the stress and the uncertainty about what is moving forward, what is not, what is on the chopping block. And I just was really struck with the public response that I saw on social media and things like that of, I didn't know they were coming for Medicaid. And now it's a real possibility. And I think there's an opportunity there for people to make sure that their lawmakers are aware of how they feel about that. Now is the time to use your voice and to let especially the congressional delegation in Washington, D.C. know how that would impact you personally. If you've got a story that you want to tell, we are always happy to amplify the stories about that too. That's just a plug for our story banking that we do every episode.
Can I say one more thing about the potential cuts? It's not just probably Medicaid as an entire program that will likely be removed.
Okay.
But even some of the other options, and I won't get into all the details, you can find them. I believe Georgetown has a memo. There are different avenues that they can affect the way that Medicaid funding works that seem a little bit more sneaky. And those will have short-term and long-term impacts on the viability of Medicaid and the viability of a state being able to afford their share of Medicaid. So what could be, and I don't want to alarm anyone unnecessarily, but there are required populations in Medicaid, like children, for example, of a certain income threshold. But there are a lot of waiver services that Kansas and other states have applied for that are not required services under Medicaid, and that the state is spending a lot of money and the federal government is spending a lot of money, and rightly so, for these populations to have the care that they need. So I think especially we should always advocate for those who need Medicaid the most, but we have some really vulnerable populations who the state might choose to stop those services that are optional right now that I don't think people are aware those are optional.
Can you give examples of what those optional waivers are?
Essentially the HCBS waivers, so the home and community-based waivers. So really, we're talking about folks with disabilities to be able to remain in their home or their community or receive specialized services.
Isn't there's a traumatic brain injury
There's a
waiver?
TBI waiver.
Is there, I'm testing my knowledge here, is there a child autism services? Look at me.
Yeah, there is intellectual and development disability, a physical disability waiver. There are a handful of them here in the state, and I'm sure other states have them as well.
Those are technically optional. So if cuts need to be made,
for some of those specific types of services through the waivers, we'd really have to have a hard look at what the state was required to continue or not. It doesn't mean that folks who are receiving services under those waivers would be completely ineligible for Medicaid entirely, but some of the services they're able to have now could not be available any longer, and they would have to meet different eligibility criteria more than likely to remain on kind of regular Medicaid, let's say.
let's go ahead and transition a little bit. I know that I was looking at KAC's 2025 legislative priorities, and I think there's a number of issues that you all are focusing on that our audience might also be interested in hearing about. In her State of the State address, Governor Kelly said that one of her priorities would be to see that Kansas children who qualify right now for reduced school lunches can get those lunches at no cost. And I know that you all have been really big in that area. Can you kind of talk about what that means? What are they looking at trying to do?
I want to give credit first to Kansas Appleseed, who has really been leading the way on covering the cost of reduced price meals in schools. But yes, it is a priority that we have signed on to. I provided testimony on the Kansas State Department of Education budget earlier this week regarding this particular item, and there seems to be quite a bit of bipartisan support for it.
Good.
However, the legislature is also, I know there's always a but, the legislature this year, the Kansas legislature, is really wanting to trim the budget. And that would be a whole other podcast, so I won't go into too much detail right now. But essentially, it is going to be incredibly difficult to not only maintain priorities that we all care about related to health in the budget, it's going to be very difficult to add new items. So I just want to be clear, this is an addition, but we think one that is worth it. So the reduced price lunch fees can be really challenging for families with lower incomes to be able to pay for their children. It can result in school meal debt, which some schools even will send a family to collection for.
Oh my.
I refer you again, Kansas Appleseed did a really great report last year on school meal debt, and it varies across the state on how schools will handle that. So it can really put a family in this difficult financial cycle within the school system. And also obviously very difficult on a child who knows their family is going through this. So it's a small ask, essentially. It is $5.5 million for the state to cover that cost of the reduced price lunch. It would essentially make a reduced price lunch eligible child have a free lunch under that program. And it would affect roughly 36,000 kids in our state. So it is something that we think is worth the budget enhancement. And again, they I believe it's actually 1:30 today. They're going to be working on that budget, and so we'll know about at least the subcommittee's recommendation, whether it can get through the full budget process. If they add it, I'm not sure, but by the time this goes out live, we might have an update.
Yeah, that's great. I think that there's a lot of stigma attached to that for the children too, and humiliation, because in some districts, I think children receive food regardless of whether their families owe for lunches, but some of that is a district by district decision. So we still have districts in Kansas where kids might be in a position where they just get, a default package of crackers or peanut butter and jelly sandwich if they're not paid up, and that means that they're not getting the hot lunch that the other kids are getting. And so I think that that can have some pretty lasting impacts on a child, not only from a health and nutrition perspective, but also from an emotional perspective.
When I was a kid, maybe others are the same, they used to put the stamp on your hand when you go through the line. No,
that was in the Kansas Appleseed report. They gave examples of some of the things you're talking about, April, whether it was a very visibly different meal that the child got. If they, again, these were mostly related to meal debt, not if you were just a reduced price lunch, taking that option, you got the same meal. But this is once you had incurred a debt with the school district, and we should be just embarrassed that is happening today for our kids.
That's wild.
Related, can I talk about another food-related
please
priority? Do. Well, we release the Kids Count data every year, and in the fall we release our data book. And one of the things really that we focused on this last fall was the increase in food insecurity in Kansas for children under the age of 18. There was a significant increase in the most recently available data that showed 1 in 5 Kansas kids is food insecure. Wow. And what was even more sad and revealing was that no county in Kansas was spared from an increase in the number of food insecure children. So all 105 counties saw an increase in child food insecurity. So related to the reduced price lunch policy we were just discussing, one of my top priorities this year monitoring the budget has been to keep Kansas in the summer EBT program. Last year in 2024 was the first year that this national program was made available, and Kansas opted into that. Fortunately, there were a handful of states who did not opt in. And what it does, it's a federally funded program that Kansas, similar to what they have to do with SNAP or the food assistance program, we have to put in a small amount of money, 50% of the administrative cost to manage this program. But summer EBT will give families, last summer it was $40 per month for 3 months for every child in their household. And it really affects the same kids we were just talking about with the reduced price lunch. It is free and reduced price lunch students, and there's some other qualifying, I believe foster children in foster care and some other programs were automatically eligible for that. So families got that on like a debit card. That's what we call an EBT card. And they could spend that on groceries to help pay for food for children over the summer to reduce that summer hunger and that food insecurity that we're seeing. And so Kansas participated last year, and because of some of the changes in the budget process this year at the state legislature, that money was not included in the base budget bill. And so we are advocating for that to be added back in so that Kansas can stay in that program. Let me give you a sense of who it impacts. There are 266,000 kids who participated in, or were eligible for, let me clarify that, who are eligible for summer EBT in Kansas. And our ask for fiscal year 2026, which would start July 1st this year for the state, we're asking for the state to put in $925,000, so just under $1 million, to draw down $65 million of food benefits.
I don't know much about odds, but
that seems pretty reasonable to do.
So it's just one of those examples of the effort that advocates are having to go to prioritize these asks in the state budget every year. I mean, that's an old story. We've all seen that. And I know there are a lot of competing priorities. There are a lot of funding aspects that are important, and there's just not money for everything. I get that. And yeah, I don't think you can ask for a better return on your investment financially, first of all, and then who it helps and the reason that funding is there.
I think one of the reasons in my mind that we have government is to take care of things that we as individuals are not able to do as well alone. And so we collectively come up with what our priorities are. And if, hungry children is not a priority that we all share, then I think that, there probably aren't very many things that we all share in terms of priorities, because it's really hard for me to imagine arguing that children should just stay hungry. Like, I don't think many Kansans are on that page. And so, we talk about the pie and the competing priorities, but I think that when it comes to things that are really foundational to the values that we hold as Kansans, we need to make sure that the pie is big enough so that it can take care of all of those types of things. And this really strikes me as something that's right up there at the top.
So well said. Well done, April. The things we're advocating for: food, childcare, education, health. These are basic needs for families to survive and for the next generation to contribute back to society. And these investments are well worth it.
Okay, so Adrienne, one of your other legislative priorities listed is to advocate for continued existing infectious disease prevention policies, including things like child immunization policies. Can you tell us more about the status of these policies in Kansas and what KAC's goals are on the legislative level?
We've been advocating to essentially maintain Kansas statute and policies on immunizations that are required for children who are attending childcare and K through 12 public schools. These have been on an increase of not only visibility, of course, since the COVID-19 pandemic, just vaccinations or immunizations in general, but these bills that we've seen that are trying to take away some of the protections of immunizations were well before the COVID-19 pandemic. And we have played one of the most visible roles in the Kansas State House on sharing the reasons why childhood immunizations are so important. And in fact, we'll be doing that again next week. There is a hearing on another bill that we have seen recycled from prior years. Unfortunately, some childhood immunizations we're seeing a decline in the number of children who are receiving those, to the point where we are becoming more susceptible to community impacts for some of these. So I'll give measles as an example. There's something, all good Kansas farmers would know, talk about herd immunity. Yeah. You have to have a certain number of people, in our case, vaccinated against some of these highly communicable diseases in order to protect all of us. There are some people who cannot medically receive vaccinations for various reasons. And sometimes there are infants. They're just not old enough quite yet to receive certain vaccinations, even though they're on the schedule, for certain times and ages. And so they rely on all of us, those of us who can be vaccinated against something like measles, to protect them and to not let that spread. And so we are seeing declining rates of vaccination to where we're getting under herd immunity or really close to that on some of these.
Well, I mean, Kansas is
City.
Kansas is in the news right now because of our tuberculosis outbreak in Kansas City. And I think, wow, that's not something that you would expect here at home. I know that sometimes when you're traveling, you kind of have to be careful for different diseases, but tuberculosis is one that we think about squarely in the past here, and certainly don't love the fact that we are in the news again for something as unfortunate as having a significant TB outbreak.
I am a Rotarian, and one of the international goals of Rotary is to eradicate polio once and for all. And we are this close. I'm holding up my fingers really, close together. But it has been a battle year over year to not only kind of convince people in other parts of the world that these are safe and effective, but they've made a lot of progress. And I think we're at a juncture in where we're all going to have to speak up and be brave about how important vaccinations and the public health system, essentially, we're going beyond just vaccinations, but really the infrastructure of disease management is in our country and in our world, because some of these they're just a plane ride away back and forth. I mean, someone could come to the U.S. at this point. It's not just other countries. I don't want to imply that, but it is becoming a serious concern that they're being taken as just an option, or there is miscommunication about their safety and their efficacy and how important they are. So we will stand up proudly and share that message in testimony in the State House. We also want to make sure that lawmakers understand how important the funding to the public health system is. So that way, when we see something like the COVID-19 pandemic, we can respond as best as we know how to keep people safe and healthy.
Yeah, I remember when one of these bills, I think, popped up last year or the year before, that it was, I probably saw something from KAC that was like, contact your legislator now. And so I real quick sent an email to my senator, and I said, my child and my husband go into a school environment every day as a student and teacher, and there are already plenty of risks, sending them into that school every day that I'm not comfortable with. I do not wish to have to worry that they're going to contract measles or worse things probably that I don't want to think of. And fortunately, she agreed with me, and that one didn't work. But it sounds like we got to do it again.
It's not a conversation that is going to go away. And in some ways, it's important to remind all of us over and over why you should stay up to date on your vaccinations, even as adults. I mean, of course, childhood is the time to receive many of these that protect us for life. But there are ongoing ones that we should all consider, and consult our medical professionals, whether they make sense for us or not as we age and our own circumstances. But we really focus on the childhood vaccinations as the critical piece here. And one other thing I'll say about them, if the health portion of it doesn't convince you as to why these are important, think about the economic impact of disease management and response. Missed time at work because either your child's sick or you are sick. There are significant economic impacts to when we are going to have disease spread in our communities.
I had a friend that sent me a message, and she had heard that they're working on a norovirus. She works in a school. She's heard that there might be a norovirus vaccine coming, and she was like, give it to me right now. Give me 5 of them. I would rather get a shot. I do not. So there are some people who are enthusiastic about upcoming vaccines, and I get that if you work in an environment like that.
For sure. It's going to be a difficult year. We're going to have to see what comes from the federal level on this. There's a lot more discussion at that level than there has been in prior years.
Did you have any other policies that you wanted to highlight?
I will, since you gave me the opportunity.
Yeah.
We are advocating for a state level child tax credit.
Okay.
And we did that last year, really made some progress on that, even so far that one was added successfully as an amendment on the Senate floor, a tailored one to 0 to 5. But the reason I bring it up is because we know that families across Kansas are struggling with various aspects of cost of living. So whether it is rent or a mortgage or transportation, childcare, all of these things, a state level child tax credit would put money back into parents' pockets to be able to help pay for the things their kids and families need. We are familiar with the CTC, the child tax credit at the federal level. That has been in place for a while, and it increased temporarily in 2021 and lifted so many kids across the country and in Kansas out of poverty. And so we know that improving the CTC works. And so that's why we want to join several of the other states that have added a state version of that. So we're working really hard to convince lawmakers that if they want to make tax changes, this is one of the best returns on investment that they can make to help the next generation and families stay and live in Kansas.
Well, Adrienne, to close out what we're talking about here, KAC has been such a good partner with us working on Medicaid expansion, which is obviously what we really focus on. And we appreciate that so much. Can you just give our audience one last plug? Why is Medicaid expansion important to Kansas children, given that children already qualify? Why do you all care about this topic?
We come back almost full circle to where we started our podcast. Before I answer your question, I want to compliment you all on the work that you've been highlighting about rural Kansas and the need for Medicaid expansion. I think the Georgetown report that we started discussing just adds more validation to the stories you've been collecting, the research you've been sharing for many years now. And so we know how important Medicaid is to the fabric of our health system to keep them open. So not only would Medicaid expansion help keep these healthcare systems open for not only adults across Kansas, but for the kids who we were just talking about may struggle because they no longer have a dentist in their town who accepts Medicaid. So there's that. But when parents are able to have health care and to enroll in Medicaid, they may realize, oh, my child is also eligible. And while they may have been eligible before, it's difficult to know about some of these programs and all of the things that we may have access to in life. And I think that this just falls under parents are busy. And while I know they care about their children's health, they just may not realize that they're eligible for Medicaid or the Children's Health Insurance Program. So if Medicaid expansion were to pass in Kansas, and I think there would be so many people celebrating that, the attention on, oh, am I eligible now? Can I finally have health care that I've been waiting for so long? We believe that that would really help create the awareness of other populations like kids who would already be eligible and be able to take that up. Because right now we have 39,000 Kansas kids who are uninsured, and that's 39,000 too many.
Yeah.
I'm not saying they're all eligible for Medicaid, but a significant portion of them could be.
Yeah, I think that's an interesting thing. For some of the families who are in the income range that the parents would qualify for Medicaid through expansion, it's just not on their radar. They may have never had insurance that was part of a job that they had. It just really might not be something that is in their day-to-day thinking. And so I think you're right. We see from other states and the experience there that once those parents get access, many of them do sign up their children who already are eligible, but it's just not a thing in their day-to-day life, or maybe even in the day-to-day life of their family members or friends or community, because, you know, that's just not been available to them previously.
And we should all celebrate if more children are enrolled because we expand Medicaid. Children are the lowest cost participants in Medicaid. So if more are enrolled because of expansion, we're not going to see, you know, significant cost increases, I don't believe, because of that. Instead, we will see kids who are getting preventive care and are able to have a better chance at growing up healthy.
Well, thank you so much for being on our podcast, Adrienne. This was great. You guys are doing so many good things. If people want to find out more about what you all are working on, where can they find you?
I encourage those who are listening to go to our website, www.kac.org. We send out a weekly State House Snapshot newsletter during the session. We convert it just back to once a month for the rest of the year. So if you want to know what we're working on during each state legislative session or throughout the rest of the year, we encourage you to sign up. We share a wide list of topics and up-to-date resources about what your state lawmakers are working on and give you opportunities for action on many of those, like we've already talked about. So please sign up there, and you can find my information on that website as well if you want to reach out directly to me.
All right. Well, thank you for joining us. If you want to find us at the Alliance for a Healthy Kansas, you can do that at expandcancare.com. We are on a lot of the social medias. You can go find us there. And we'll talk to you again in 2 weeks. Thanks for joining us.
Health in the 34th is a podcast from the Alliance for a Healthy Kansas. We hope you'll take a moment to subscribe and share our podcast with others. Episodes written and produced by Marissa Alcatar and Lacey Kennett. Episodes available on Apple Podcasts, Spotify, or wherever you get your podcasts. Join the movement and get involved. We're on Facebook, Instagram, Twitter, and TikTok. For more information on the Alliance for Healthy Kansas, visit us at expandcancare.com.